As you see, we are the Health Literacy Program at Latin American Youth Center. I am our coordinator, Finn Finney.
And my name is Alejandra Sepulveda, and I'm the Health Literacy Community Mobilizer for LAYC.
Hello, welcome. On today's agenda, we're going to talk about campaign development. We went over that a little bit earlier, but we're going to go in depth with an example. Delivery and evaluation. That'll be for campaigns, but also for the different programs that we're talking about. Capacity building for youth and staff to do health literacy work, and our lessons learned over the course of this program.
Hi, so I would start you with campaign development. And first I will walk you through a general timeline of what a campaign development process would look like at Latin American Youth Center, and then I would do the same thing and walk you through an example of a campaign we implemented. So to start with, step one, as when you're thinking of a campaign, I want to believe the first thing we're thinking of is what is the purpose of this and what would be the goal. So our messaging goal and our target audience would be the first step in identifying who those are. Messaging goals could vary depending on the campaign. So let's say during COVID you would want a group of ages 14 to 16-year-old youth to get vaccinated at a certain rate. So that would be, your messaging goal would be appropriate to that. And your target audience in that case would be that specific age group. Moving on to step two would be to define and recruit those messaging allies as well as those trusted messengers. In some cases, or in our case, those are usually the same. So our messaging allies and trusted messengers could be our staff or our youth, or in some instances, interns and other youth ambassadors that we have throughout our different programs. And with step three, identify perceived barriers. For LAYC and within our team and through our health literacy efforts, we sometimes like to start off with general barriers, so things that we have found that is a challenge through different campaigns, through implementing different messaging materials, as well as what could become a challenge with the specific campaign, or the implementation of an activity or programming per se. And lastly, the fun part, which is designing the campaign, designing the materials, designing the activities, really thinking of how can we make this fun for our youth, how can we get the message across, and implementing it. Now, moving on with our example, we implemented a campaign with a menstrual product dispenser machine. The company, I believe, is called Outflow, and I think they're a nonprofit with the purpose of bringing these menstrual products to underserved communities nationally and around the world. And with step one, we identified that our goal was to educate our staff as well as our youth on what are those menstrual products available and how to use the actual machine. So that was our messaging goal in step one. And as you can imagine, our target audience was our youth. Staff was there, but with staff it worked a little bit different because we could do trainings, but with youth we really had to think of, when we're not there, how are they going to understand that this is how they're going to use this machine and what products are available in it and how to dispose of them as well. With step two, we identified that our superstar team would be the sexual and reproductive health staff. So as you can imagine, they have the expertise with sexual health topics, and they also have feedback and historical experience with youth and implementing topics that are similar to this. Then in step three, we also identified that some of the barriers that could arise are language barriers, language access barriers, and with that I mean not only are we translating these materials to Spanish, but also are they easily understandable to the different age groups that we have in our youth population, because we have youth all the way from 10 years old to 26, 25 years old, and as you can imagine, that's different levels of understanding for this topic that can be very complex, right? And lastly, designing the materials and implementing them, and mostly the implementation looked like putting those flyers up through our bathrooms right next to the dispenser machines, putting up social media content as well, letting our social media community know, hey, now we have these products available and this is what it looks like to use them. These are the products available, whether it's pads, tampons, and we have other resources that you could reach out to us and we could provide it to you to know, oh, this organization focuses on this, they have this other products, and to let us know if you want to see, you know, anything else available that we could provide you.
I just wanted to add, this was a really interesting campaign because the sexual and reproductive health team chose to reach out to us and make sure we were involved in that process because they knew they were getting something new that's not quite how these youth not quite something these youth have interacted with before. Instead of being a paid machine, it's a free machine. They're not sure which buttons to press. They physically say tampon and pad in English, so they might struggle if they're Spanish speaking to know which side distributes what. So yeah, it was a really great example of our ability to create allyship over the course of this program by having that connection already existing. And then we're going to talk a little bit about the delivery and evaluation of these different campaigns that we participated in. So something that was important to us was working within audience need. And we looked at was not just what is our personal goal in providing this information, but what do they like, what do they want, and how do they like to provide feedback on these things. We talked about usability, so specifically with the menstrual products, our concern was that folks may not be able to read a long sign. They might need to do something quickly. So we gave pictogram and pictures so they can quickly see what they need, grab it, and move on. We're going to talk about diverse feedback requires diverse methods. So what we say when we mean that, what we mean when we say that is we use simple universal signs to allow everyone to participate at every level. So we might have a survey that people can fill out and provide feedback through a QR code, but we might also have a bucket that says if you put it in this side, then it means positive. If you put it in this side, it means negative. And we might use red and green, which are easily associated colors with these concepts, or a smiley face and a frowny face. We also talked about making sure our content was easily understood. So we went through a few different versions of what our flyer might look like. And we actually wound up removing most of the text from what we'd created and going with mostly pictures and a diagram. And we also talked about highlighting strengths over weaknesses when we're taking feedback. So one strength that we thought about was folks will have time in the restroom to really think about what they're using and interacting with. But they may not, a weakness is that they may not be able to go on their phones. So we really highlighted that strength of they want to provide this feedback immediately on using this and gave them a way that they could without necessarily using a device and touching something. And we talked about how client success is key. Outside of our evaluation, we looked at metrics around use. So are folks able to use the pads and tampons? Are we replenishing them? Have we had any responses that something's not working? Do we have something outside of our formal evaluation that shows their response to it? And then in addition to our ideas around feedback, we talked about usability over aesthetics, which means the content that we're providing may not be beautiful, it may not be the most attractive thing. You're in the restroom, you're not looking for something long to read, but you're looking for something that you can quickly use and move on. A little more about delivery and evaluation. We talked about language inclusive learning, anonymous and accessible feedback methods, and health literacy as a foundation rather than a secondary goal. So health literacy as a foundation means that when we're working with teams to help them produce a campaign, or when we're giving feedback on a campaign, we are starting from the ground level with, here's our requirements around health literacy. We expect it to come out looking like this. We expect it to utilize these pieces and to present this way. And that allows folks to have creativity over what they're making. So rather than coming to someone and saying, I don't like all of these things about your flyer because they are inaccessible, you're coming to someone and saying, I love all the things about your flyer because they're accessible, and I really love the color that you put on there and the pieces that you were able to be creative with. And that also reinforces the existing strengths of these different teams, and it allows us to create better evaluations. We learned with our feedback that a lot of folks have a preference towards anonymous methods, and they have a preference towards different types. Almost every single person had a different response to the different ways that we try to evaluate them. And we noticed that a lot of folks really preferred informal methods of evaluation. So when we're casually having a conversation and we're taking note or we're taking mental note and we're coming back to that, versus giving them a formal survey that might take 10 minutes to complete and they forget. And we noticed that more access creates more feedback, so when we create more methods and we create more accessible methods, we get more diverse responses and more complicated responses. And then we already talked about, but with language, we considered ways beyond just having it translated and available translated, how we can anticipate that need for anyone of any language or any understanding to be able to interact with their content.
Hi, so bringing you on to capacity building. During the implementation of our health literacy efforts with LAYC youth, we really understood that these three pillars right here are the basis for us to continue to increase health literacy levels for our clientele, which is our youth. And I believe the first one and the third one, which are fun as well as positive youth development framework, when we keep those as the foundation of our programming, our messaging materials, our activities, anything that you can think of that is a service and we're putting it out there for our youth, this really has increased the engagement that we have with them, it has increased the connection that we have with them, and it does get the message across, which is what we ultimately want. We don't want to sit them there for a lecture when we can do a fun activity, when we can start with a fun icebreaker, and then we can get into the nitty-gritty and the formal and serious things, but that should not take the bulk of everything. And if you anticipate that to be the bulk of the activity or the event, then I'm sure there are strategies that you can implement it to be fun and to be engaging, as again, our primary audience is our youth. So we really have to think of sometimes what age group is our youth. Sometimes we have college age groups, so they are able to take into those more serious, more lecture-like, let's say workshops and activities. Maybe they want to talk about things that are a little bit sometimes out of our expertise, and we're able to tell them and let them know, hey, we can come back to this question and we will connect you to the person that actually knows about this. Whether with younger youth, they have all these different questions sometimes all at the same time, and you have to figure it out, creative ways of answering them, and sometimes just creating another event and another activity to bring back this knowledge to them. And with that, it also, with the positive youth development, which is what I wanted to connect to, is that youth love to have ownership of something. They love to know that they created this, that they developed this, that they were able to present this to you or to a group of people or promote a service to their community. So really having those opportunities and always keeping this in mind when creating something as the health literacy team and as an organization. How can we let them know that they're honing into their leadership skills and that they would get out of this activity or that they would take this as a takeaway from this programming, that they're able to be leaders in their community, right? And lastly, we also have the recognition and constant rewarding of our staff. So without them, we wouldn't be able to make all of these efforts and all of these initiatives at LAYC. And some of the ways that we have recognized them as well as rewarded them was through raffles, weekly raffles, and sending out email shout outs, letting them know, hey, if you made this many referrals this week, because obviously we can see the data in our end, you get this gift card, for example, and you can pick it up here, or we can send it to you, or let us know where you want us to meet you so that we can give it to you. And also we had plenty of opportunities for those. So there were individual raffles, there were group raffles, many different ways. But this is how, these are the three pillars that we understand are essential to sustain capacity building and make health literacy an effort that sustains over time, even when we're not there.
And something really cool about our last point, positive youth development and allyship, those are trainings that LAYC offers and are actually required of new staff. And if you're already existing and haven't yet taken that training, you have to participate. And that creates universal understandings that really gave us the opportunity to thrive. In our explanation of health literacy, one of the main things we learn in positive youth development is Hart's Ladder. And that is a model showing participation where the base level means you are exploiting the group you're working with, and the top level is the absolute most participation. You're directly communicating with these folks and they're able to have really close buy-in. And yeah, that just gave the folks that we worked with and we allied with over the course of this program a really easy basis to start from. And now we're going to talk about the lessons we learned throughout this program. This is just a few of them. Our main points are decision maker buy-in, scope of work, and sustainability. We talked about how decision maker buy-in is something that's important not just from the top down, but from the matrix of the way that your organization works. And for our organization, that means different teams might have multiple different decision makers within their structure. We talked about how different kinds of decision maker buy-in from the beginning of our program might have created different outcomes, like if we had worked more closely with our positive youth development deliverer, how that might have come out differently. Decision maker buy-in also allowed us to create allyship networks between teams, and greater decision maker buy-in would have meant greater allyship networks and greater ability to connect. For scope of work, health literacy is a really broad topic, and no matter how many times you explain it, a lot of folks don't understand that it's directly connected to the work that they're doing. So it can be a little difficult to create buy-in around it. And when we define a scope, when we're really specific, it creates more sustainability. So it did create some differences there. And for sustainability, we talked about how health literate processes actually increase our organizational sustainability. So when our teams are applying for new grants now, they can think about these new skills that they've learned through working with us and how they've affected and maybe even improved their processes, and probably be able to better apply, better phrase their narratives, things like that. And we also talked about how decision maker buy-in creates more sustainable programs. So when you have people who are making decisions around programs, like our sexual and reproductive health team reached out to us to help them plan some purchases that would be more health literate and create more access. And that allowed them to sustain the accessible pieces of their program. Do you have anything to add?
I think this is it. Thank you so much. If you have any questions,